I am Dr. Stephanie Bose, the medical director of EverLoved Vet Care. We're located in the Central Florida area, and we want to just introduce ourselves and talk about our practice and what brings us to this end of life space.
Hi, I'm Holly Yoerger, and I am a client care coordinator for EverLoved.
So, Holly, you came to us with an extraordinary background in which it didn't necessarily have veterinary care in it. What brought you to EverLoved?
One of the things that I found so special about EverLoved was the connection to the people in our community. And with my background, that is something that is just so important to me. I found that the support to families is something that may be missing in some veterinary practices. And as a pet owner myself, I thought that was so impactful, and I thought that was a wonderful way to connect with people in our community and very needed.
Awesome. So what would you think is such a core value of EverLoved, and how are you contributing to that every week, every day?
Yeah, that's such a great question. I think that at the heart of what we do is compassion through every step of the process. So I understand as a client care coordinator that when you call, it's a difficult call to make. And I want each and every one of our clients to feel the compassion in the intake process, the compassion in the appointment itself, and after. I never want our clients to feel rushed, and I want them to know that this is our sole purpose, is providing you support during this time. Now, other veterinary practices, of course, they provide wonderful services that can be similar, but we just find it so meaningful to provide support in home with your family so that we can support you every step of the way.
I think that's awesome because a lot of times when you think of veterinary medicine in general, you constantly hear of veterinarians going into it because they love animals.
Right.
And they love pets, and they collect pets since they were really young. And that's amazing. And I absolutely want to confirm I love animals and the pets. But I think one of the main reasons I even got into veterinary medicine in general was to support the whole family.
Right.
I was able to be there for the entire group and be the advocate and voice of the pet, but work with the family in order to find the best care solutions for them.
Absolutely.
And it was so individualized. And I think even more so, that drew me into this space because it is so much more about the entire family and making sure everyone feels supported.
Right. How do you feel about your ability to practice how you want in a general practice versus the time that you get with our clients now? How do you feel that those compare?
It's such a night and day experience. And it's hard to sit there and compare one being better than the other because in general practice, you have to be able to see as many patients as possible on a daily basis in order to treat varying degrees of illnesses or wellness appointments. There is a booming amount of pet ownership in America in general, and the need for veterinary care is pretty much exacerbated by that boom.
Yes.
But when we're talking about in-home care and being able to literally slow time and discuss at anyone's pace about a different diagnosis or process that the pet is going through, the end-of-life space is such a delicate moment. It's so important as well.
Right.
And everyone deserves that kind of honed in attention and time.
Absolutely.
So I think it's one of those things where I'm able to give them time in order to explain and teach and offer that peace of mind when it comes to these decisions.
Right.
Because this is what we do. This is what we specialize in.
Right. I feel similarly. It's such a gift to be able to take my time with each client. And, when we talk about our core values, I think one is certainly compassion, but the other is professionalism. I want to always make sure that I have all of the most accurate, up-to-date information to provide our veterinarians so that you can spend your time in the appointment in an efficient way, in a way that really allows you to focus on the family, on the pet, the best you can. So you come to that appointment, we always arrive equipped and ready to really put your family at the forefront. Preparedness for sure.
Absolutely. The idea of EverLoved too, we're created to be an extension of a veterinary practice or this different type of arm of medicine. We want to be able to provide clients and families an extension of what they've already been given at their other practices.
Right.
A better understanding. And because we do specialize in offering this time, we can complement other practices in order to help guide any decisions.
Yes, certainly. And I think that our relationship with the veterinary practices around us is really a symbiotic one. It's really great to be able to help clients feel supported while communicating with their vet clinics on what their needs are. So it's a great relationship that we have with our surrounding veterinary clinics, and we want them to feel supported as well. And sometimes it's a client may be seeking an in-home service for a quality of life assessment or an in-home euthanasia, and they just don't have the capacity to offer that, but we can work with them and come to your home and offer that service, which is great.
I think one of the things that makes EverLoved very special to a lot of families is the fact that we are there to support them not only before and during, but absolutely afterwards.
Yes.
And oftentimes when families choose to move forward with aftercare services through cremation, you're able to bring their baby back home to them in person and follow up and make sure that they feel as supported as possible.
Yes.
Can you tell me what that experience feels like for you?
Absolutely. So I would say that the ability to myself return memorial items and return somebody's pet to them in home is probably the most rewarding part of my job. I'm able to, it really comes full circle for me because I get to meet this person that I talk to on the phone, and just seeing the relief in their face when their pet is finally home and they can really start that closure is definitely one of the most rewarding parts. I think being able to provide and return the memorial items to them in home is just a relief for the family. It's something that you don't have to worry about, and we will take care of it. We will say, we can promise you that everything is going to be okay in that time that we have a transfer and then bring them back to you. I think the aftercare part in taking care of it is just a relief for so many families that they don't have to think about that. And it truly is a beautiful way to honor your pet, and I think that is so important for families.
And I think that's beautiful how we're able to create this very seamless, very well-rounded, personalized experience to certainly honor the life.
Yes.
And then in addition, we're able to then offer these support group through Zoom with our veterinary social workers.
Yes.
And while I know that many people have amazing support systems behind them as far as family and friends during this time, and even we're able to offer a sense of peace and comfort, we're not the licensed one when it
Right.
comes to handling grief and understanding it. And it's real, even when pets pass away. They are family members. They're
Yes.
our kids.
They do so much for us throughout their entire lives, and
Yeah.
it's such a great way, to honor them towards the end of life. But you're left with that hole, and we want to make sure that you feel supported as well at the end.